I want to tell you about something that happened to a retired postal worker named Edward from Memphis, Tennessee. Edward is 73 years old. Every month, without fail, he sits down at his kitchen table and writes out the same checks: Medicare premium, prescription copays, the occasional doctor bill. He has been doing it for 7 years since he retired. He assumed this was just what retirement looked like. Last year, his granddaughter, who works at a hospital billing office, sat down with him and went through his paperwork. It took about 40 minutes. By the end of that conversation, Edward found out he had been paying 3 separate bills every single month that he legally did not have to pay. Programs existed to cover them. Applications were sitting there waiting to be filed, and nobody, not his doctor, not his insurance, not Medicare itself, had ever once told him they were available. Edward filed the paperwork. Within 60 days, his monthly out-of-pocket medical costs dropped by over $300. $300 a month, $3,600 a year, 7 years of overpaying. Edward's situation is not unusual. It is, in fact, the most common financial story I hear from American seniors right now. Not because they are careless, because the programs that are supposed to help them are buried under confusing names, hidden behind applications most people never see, and the people who need them most are the last ones who ever go looking. Today, I am going through 5 specific medical bills that millions of seniors are paying right now when they legally do not have to. For each one, I will tell you exactly what the program is, who qualifies, what the real numbers look like in 2026, and exactly what you do to claim it. Stay until the end, because number 4 is the one that surprises almost every senior I talk to. And it requires 0 applications, 0 income verification, and 0 paperwork. It is already part of your Medicare, and you are probably not using it. Medicare rules, income limits, and benefit programs change every single year. When they change, nobody sends you a letter explaining what it means for your situation. That is exactly what this channel does. Subscribe, and let's get into it. Before I get into the 5, let me answer the question I know some of you are already asking. If these programs exist, why has nobody told me? It is a fair question, and it deserves a straight answer. These programs pay out only what gets applied for. There is no one whose job it is to look at your situation, pick up the phone, and say, based on what you are paying, you qualify for this. Let me get you signed up. That person does not exist. The benefits sit under government names most people have never heard of, behind applications that are never automatically sent to the people who need them. And the income limits are almost always higher than people assume, which means the people who most need to check are the ones most likely to have already decided they do not qualify. Do not make that decision at your kitchen table. Let the application do the math. Bill number 1, the Medicare Part B premium. Every single month, if you are on Medicare, a specific dollar amount gets pulled directly out of your Social Security check before the money ever reaches your bank account. In 2026, that amount is $185 a month. That is $2,220 a year, leaving your check automatically without anyone asking your permission. Most seniors accept it without question. They assume it is just part of having Medicare. What they do not know is that there are federal programs called Medicare Savings Programs that will pay that premium for you entirely every month through your state Medicaid office. Not reduce it, pay it. Which means that $185 stops disappearing from your Social Security and your check goes up by that amount, starting the month your approval comes through. There are 3 versions of this program depending on your income level. The most comprehensive one is called QMB, Qualified Medicare Beneficiary, and it does not just cover the Part B premium. It covers your deductibles, your copayments, and your coinsurance. The bills that land in your mailbox after a doctor visit. All of it covered. If you are single with a monthly income under approximately $1,235, you very likely qualify for QMB. For a married couple, that line goes up to around $1,663. If your income is a little higher, up to around $1,478 a month as a single person, the other two versions, called SLMB and QI, will at minimum eliminate that $185 monthly premium entirely. Think of a woman I will call Patricia, 68 years old, widowed, living on a Social Security check that never quite stretches to the end of the month. Every month, $185 of it disappeared before she ever saw it. She assumed that was just how Medicare worked. When someone finally sat down and ran her numbers, she was under the line. Her state took over that premium. Her check went up by $185 a month. And nothing about Patricia changed, except that somebody finally told her the door was open. Most people never get that somebody. How do you claim this one? Call 1-800-MEDICARE or go to medicare.gov to find your state's Medicaid office. Or call your local SHIP office, State Health Insurance Assistance Program, and say these exact words. I am on Medicare, I am on a fixed income, and I want to know if I qualify to have my Part B premium paid. That sentence is enough to get the process started. It is free to apply, and nobody legitimate ever charges a fee. Bill number 2, prescription drug costs. A lot of seniors think, I have Part D, I am covered. Covered and free are two very different things. There is a federal program called Extra Help, sometimes called the Low Income Subsidy, and if you qualify for it, your prescription situation looks completely different from what you are dealing with now. No Part D premium, no annual deductible, and the most you would ever pay for any covered medication is $4.50 for a generic, or $11.20 for a brand name drug per prescription. That is the ceiling, not per month, per prescription. Compare that to what people without this program are paying: $50, $80, sometimes over $100 a month for a single medication. And you start to see how much money is quietly leaving people's pockets year after year. The income limit for Extra Help in 2026 is about $22,590 a year for a single person, roughly $1,882 a month. For a married couple, around $30,660 a year. Here is a shortcut most people do not know about. If you already got approved for the Medicare Savings Program I just described, you are automatically enrolled in Extra Help. No separate application, it just kicks in. If you have not done either yet, apply at ssa.gov or call 1-800-772-1213. And if you take multiple medications every month and you are paying anything close to full price for any of them, this one program could save you hundreds of dollars a year. Bill number 3, long-term medical costs and Medicaid. This is the one most seniors dismiss immediately. They hear the word Medicaid and they think, that is for people with nothing, not for me. And that assumption is costing a lot of people a lot of money. Here is what Medicaid actually covers for seniors who qualify: nursing home care, in-home care services, personal care assistance, long-term support. These are costs that can run $5,000, $8,000, even $10,000 a month, and Medicaid covers them for people who meet the eligibility requirements. The rules around Medicaid for seniors are complicated, and they vary significantly by state. But here's the key point most people miss. Qualifying for Medicaid does not always mean you have nothing. Many states have what are called Medicaid spend-down programs, where seniors with moderate income and assets can still qualify for coverage once their out-of-pocket medical costs reach a certain threshold. And here is the number that matters. According to the Administration for Community Living, more than 11 million Americans over the age of 65 currently need some form of long-term care services. The average cost of a private nursing home room in 2026 is over $9,000 a month. Most seniors cannot cover that from Social Security alone. If you or someone you love is facing significant long-term care costs and you have not spoken with a benefits counselor about Medicaid eligibility, that conversation is worth having. Not because you will definitely qualify, because you do not know until someone who understands your state's specific rules looks at your specific situation. Your local area agency on aging can connect you with a free benefits counselor. Call 1-800-677-1116 to find the one nearest you. No cost, no commitment, just information. Bill number 4. Preventive services you are already paying for but not using. This is the one that surprises almost everyone, and it requires no application, no income verification, and no extra paperwork, because it is already part of your Medicare, and you may not know it exists. Medicare covers a specific list of preventive services at zero cost to you. No copay, no deductible, no bill. Here is a partial list of what is included. Annual wellness visits with your doctor, cardiovascular screenings, cancer screenings, mammograms, colonoscopies, lung cancer screenings for qualifying seniors, diabetes screenings, depression screenings, bone density tests, flu shots, pneumonia vaccines, hepatitis B vaccines, all of it, $0 out of your pocket. But here is where the money gets lost. Many seniors go to their doctor for one of these services and end up paying a copay anyway. Not because they were charged incorrectly, but because of how the appointment was coded. If your doctor bills a wellness visit as a regular office visit rather than a Medicare annual wellness visit, Medicare's zero-cost benefit does not apply. You get a bill. The fix is simple. Before any appointment, call your doctor's office and confirm that the visit will be billed as a Medicare preventive service. Ask them to verify the billing code. Those 11 words, "Will this be billed as a Medicare preventive service?" can save you $100 or more on a single appointment. And if you have not had your Medicare annual wellness visit this year, schedule it. It is free. It covers a full review of your health, your medications, your risks, and it costs you exactly nothing. Bill number 5, Medicare Advantage supplemental benefits you do not know you have. If you are enrolled in a Medicare Advantage plan, not original Medicare, but a Medicare Advantage plan through a private insurer, there is a very real chance your plan includes benefits you have never used and possibly never knew existed. Medicare Advantage plans are required to cover everything original Medicare covers, but many of them go further, and the additional benefits vary significantly from plan to plan. Here is what some plans are currently covering in 2026 that many enrollees have no idea about. Dental care, cleanings, x-rays, sometimes more. Vision care, eye exams, glasses, or contact lenses. Hearing care, hearing exams and hearing aids, which original Medicare does not cover at all. Transportation to medical appointments. Over-the-counter medication allowances, a monthly or quarterly credit you can use at participating pharmacies for common health items. Gym memberships or fitness program access. Meal delivery after a hospitalization. Home safety modifications for seniors at fall risk. These are real benefits, already paid for as part of your plan. And according to research from the Kaiser Family Foundation, a significant number of Medicare Advantage enrollees never use the supplemental benefits their plan includes, simply because they did not know they had them. Here is what you do. Call the member services number on the back of your Medicare Advantage card and ask one question. What supplemental benefits does my plan include that I may not be using? Write down what they tell you. Then use them. If you find that your current plan's benefits do not match your needs, Medicare's annual open enrollment runs October 15th through December 7th each year. That is your window to switch to a plan with better coverage for your specific situation. Let me bring all 5 together, because when you see them stacked up, it lands differently. The Medicare Part B premium, $185 a month that savings programs can eliminate entirely, plus deductibles and copays in the most comprehensive version. Prescription drug costs. Extra Help brings your per prescription cost down to under $5 for generics. For someone on multiple medications, that can mean hundreds of dollars a month. Long-term care costs. Medicaid coverage that can protect you from costs of $9,000 a month or more for seniors who qualify. Preventive services. Already part of your Medicare, already paid for, zero cost to you, if you know which appointments to request and how to make sure they are billed correctly. Medicare Advantage supplemental benefits. Dental, vision, hearing, transportation, over-the-counter allowances. Already included in plans millions of seniors are enrolled in right now, going unused. None of these programs come looking for you. The money sits there waiting for an application, a phone call, or a question that most seniors never think to ask. Edward eventually got his paperwork sorted out, but he told me something afterward that has stayed with me. He said, "I did not know I was supposed to ask. I thought if I was entitled to something, someone would have told me." That is the thing. Nobody tells you. The system is set up to pay out what gets claimed, and the seniors who claim the most are not the ones with the most money or the most connections. They are simply the ones who found out what questions to ask. You now know what those questions are. Before you close this video, share it with one person you know who is on Medicare. A parent, a neighbor, a friend. Because the 5 bills I just walked through are landing in the mailboxes of millions of seniors every month. And every one of them is either reducible or eliminable for people who qualify. They just have to know to ask. Subscribe and turn on the bell. I will see you in the next one.